Hi, everyone. Good afternoon. As Michael mentioned, I am the director of the Duke AI Health Data Science Fellowship Program, and I'm going to spend a few minutes today telling you about the program and hopefully convincing some of you that you'd like to apply to be a fellow in the program, as we have some applications out, and you'll be hearing more about that in a moment. Basically, the program has two parallel goals. We are, as described here on the screen, so we are doing health data science. We place fellows in projects to do the work, to get the health data science done while they are training. We provide a framework for training so that we are preparing the health data science workforce of the future. As Michael mentioned, the fellowship program is part of the larger Duke AI Health initiative with the focus, as I said, on data science with healthcare applications. It's a 2-year training program, and it's very much modeled on a clinical fellowship approach. We look for candidates with very strong quantitative backgrounds. So we're looking for biostatistics, statistics, BME, we've had economics applicants, so a broad range of quantitative fields are of interest to us. And generally, we're looking for candidates who are recent master's graduates, although there is some flexibility around that. The program was launched in fall of 2019. We've had about 12 fellows so far. We tend to have 8 to 10 fellows at a time. So when we bring in a fellow, what we do is we place them in a project, and we really are throwing them in the deep end of health data science. And they have the opportunity to work on important projects that are really making a difference in clinical care. And you see here some examples of projects that fellows have been placed in so far. You've heard some descriptions of cachet kinds of projects, and we'll be bringing in more fellows to work on cachet projects in the future. So we're very excited about that application process. But as we're saying, so I said we throw the fellows into the deep end and put them on these projects, but we build a structure around them. And the idea is that the structure is there to ensure that they're succeeding in the health data science projects that they're working on and learning at the same time. And we think of it very much as dual communities. So the fellows are placed in these interdisciplinary data science teams. So that's sort of within the context of the clinical department where they're working. And they're paired with a clinical lead who's generally a faculty in School of Medicine or in the health system. And they are generally the ones who have identified the clinical problem or providing the clinical context and driving things forward. We also, on these teams, have a quantitative lead. So that's faculty from one of the quantitative departments at Duke. And they are providing not just mentoring to the fellow, but they're driving the quantitative methods for the project. And then depending on the project and maybe the personalities of the quantitative lead and needs of the fellows, we sometimes will also assign a statistical mentor, which is a staff statistician, and they're sort of boots on the ground, helping the fellow with day-to-day, how do they connect to the server, the computing server, and just sort of very practical kinds of questions. If the project needs it, we'll place an informaticist. We always have project leaders associated with these projects. We just want to make sure that there's somebody whose job it is to make sure that things are getting done on time, deliverables are being met, and everything's moving forward. So that's the data science teams, the sort of the project side community. Then the fellows also are embedded very much in the fellowship program community. And that consists of program leadership, which is me and Associate Director Silvana Lovere. Also statistical mentors that are associated with the program that overlap very much with the statistical mentors I described for the interdisciplinary data science teams, and then other fellows. We have sort of formal and informal approaches to bringing the fellows together. They present to each other, they share tips and tricks and challenges, and socially they get together a lot too, I understand. And then finally, to make sure that learning is happening while the data science is getting done, we've specified learning objectives for the program. And you'll see here several objectives written out. These are the broad, general objectives for everyone. We also work with fellows when they start in the program to tailor these objectives to their career goals and interests. And then we check in with them periodically to ensure that they're doing things to move forward in meeting all these objectives. But you'll see here like different categories of objectives. We start with making sure the fellows can comprehend and understand the big picture clinical question. These objectives here in green, in the green font, are related to what I would call good data science practice. So objectives around understanding the data, applying appropriate methodologies, reproducibility, and using good programming practices. We also really emphasize communications. I think we can all agree that a good data scientist will have excellent communication skills. And we push the fellows hard on that and give them a lot of opportunities to practice and improve, and they get a lot of feedback on that. And then these objectives here in purple are related more to growth. So self-awareness, encouraging fellows to be constantly learning and growing, both in terms of their, again, soft skills and then also their technical skills as well. And then I'd like to touch on this objective here around diversity, equity, and inclusion, especially in light of the theme of this panel discussion and some of the topics that prior presenters have touched on. We have this objective around DEI, and we think of it in a couple of contexts. One is the workplace. So, how you often would think of DEI. So, we encourage the fellows to have conversations with colleagues to look at how their project teams are working and encouraging an inclusive environment. But we also really want them thinking about health equity principles and learning about that. And so going to trainings, thinking about how it applies in the context of the work that they're doing, and building a library for the program to help with these sorts of things. And we encourage fellows to contribute constantly to that library as they learn more. And Michael Carey, I have to tell you that I've made a note that I'm going to reach out and ask you to come speak with our fellows. That's one of the things we do, is have speakers come in to talk with the fellows about, sort of scientific areas, but also career growth opportunities and so on. And Michael, I would love it if you would come talk with us. So we'll be reaching out. So in conclusion, to go back to my first point, which is I hope I've convinced some of you that you would like to apply to the fellowship program. I believe that there should be a link to the announcement and application being posted in the chat. And of course, if you are interested, feel free to reach out to me. I'm always happy to talk about the program. Thank you.